My name is Autumn McCoy. This is for NUR 435, and this is trach care and trach suctioning. So before going into the room, I would have looked at the doctor's orders and saw when the last time the trach was changed and stuff. So walking into the room, I provide patient privacy, do hand hygiene. Can you tell me your name and date of birth? Okay, great. I'm going to be doing trach care and trach suctioning, just because it sounds like you have some mucus in there. So walking in, I immediately notice that there's an obturator and then a smaller sized trach in case it falls out and closes or wants to close, and then an ambu bag is nearby. So I'm going to go ahead and hyperoxygenate the patient by turning it all the way up, making sure that they have enough airflow. I'm going to raise the head of the bed to semi-Fowlers. And then I'm also going to put a towel across the patient's chest, just in case anything falls out. So I will turn the suction up to between 80 and 120 continuous, because I will be providing the intermittent suctioning. So hand hygiene again. I will be putting on clean gloves, just to kind of get all of my supplies ready. So here I have suction tube, and I'm going to go ahead and move that out of the way. Discard of my gloves there. Putting my sterile gloves here. Then I would take this and fill it up with saline, but for the sake of the video, I'm not going to. I would keep it on my sterile field. I would take the suction catheter out, making sure not to touch anything with it. And then with my dominant hand, I would hold it with this, and then with my non-dominant hand, hold it with this, stay in the sterile field. And I will take my non-dominant hand, which is now dirty, attach it to the thing, and then make sure it's suctioning, and then I'll lube it up. And then I will make sure to tell the patient to raise a hand or blink really fast to let me know if they're uncomfortable or something. All right, I'm gonna go ahead and start. So as I'm going in, I'm not gonna suction. So I'm gonna go in until I meet resistance, and when I do, I'll pull it out about two inches. And then as I'm coming out, I'll provide intermittent suctioning while rolling the suction catheter. And then I will clean out the suction to make sure that it's clear, and then I would assess to see if she needed to be suctioned some more. And before I suction, I would make sure to assess the lung sounds and the respiratory rate, just to see what her status is before suctioning. So she seems to be doing okay now. Won't have to suction anymore. I'll make sure to only suction for about 10 seconds, and then I'll wait about 30 seconds in between each suction to start again. So she's good now. So I'm gonna go ahead and throw that away. So I'm gonna go ahead and do trach care. So I'll provide hand hygiene. So I'm going to open my kit. And then Okay, well my glove rolled, so I would have gotten new gloves and reapplied them sterilely. Okay, so now I'm going to create my sterile field by opening the drape. So now I would pour about half of the hydrogen peroxide in there, and I'd pour normal saline in there to kind of help dilute it a little. And then I would pour half of my sterile water in there, and then I would pour just plain sterile water in that one. Okay, so with my non-dominant hand, I will replace the trach. And then when I do this, I will inspect the site and make sure that there is nothing, no secretions or foul odor, and if there was, I would make sure to document that and probably get a culture. So okay, well, if this really happened, I would just get a whole new kit and start all over, but okay. So with my non-dominant hand, I have the trach, I'm keeping it in the water, and I'm taking the cleaner to clean it, make sure to get all the gunk out, and then I'll set it in the hydrogen peroxide, and then take my dominant hand now to put it in the normal saline to kind of rinse it out. I will then take my dominant hand to put it back in there. So now my hands are no longer sterile. So if the ties and then the gauze underneath were dirty, then I would use these Q-tips adapters to try to push it up in there and make sure that it's snug against so it doesn't cause skin breakdown. And then I would also call somebody for help when changing the ties so that if she coughs or if she sneezes or something, it doesn't fly out. So then I would document any secretions, any odor, how she tolerated it, and just make sure that the obturator and the smaller trach size is still here. I'd make sure that the ambu bag was still here. I would put the oxygen back on, turn it back down to whatever the doctors had ordered for her, and put the bed back down to the lowest level, and just make sure that she had a call light and was as comfortable as could be.